Did you know that around 80% of people with chronic kidney disease have a vitamin D deficiency? That's just one example. Nutrient deficiencies are common among kidney patients and can significantly affect their health. So, in today's video, we'll walk you through the 12 powerful nutrients kidney patients can't afford to ignore, kidney-friendly food sources for these nutrients, and how much of each nutrient your body needs to stay healthy. Keep watching. Nutrient number 1 on our list is omega-3 fatty acids. For kidney patients, omega-3 fatty acids are important because research has shown that their two main types, docosahexaenoic acid, or DHA, and eicosapentaenoic acid, or EPA, can help reduce inflammation, one of the main contributors to kidney damage and disease. Inflammation is generally the body's natural response to injury, infection, or chronic conditions where the immune system releases chemicals to fight off harmful substances and begin the healing process. However, when inflammation becomes chronic, it can cause tissue damage and worsen chronic conditions, including kidney disease. This is where omega-3 fatty acids help. They have anti-inflammatory properties, which can help reduce inflammation, slow down the progression of kidney disease, and protect the kidneys from damage. But that's not it. Omega-3 fatty acids can also help lower high blood pressure, the second most common cause of kidney failure. They help prevent the buildup of triglycerides and cholesterol in the arteries and help blood vessels relax and dilate, which can improve blood circulation and lower blood pressure. Many experts suggest that healthy adults need 450 to 500 milligrams of EPA and DHA every day. However, if you are a kidney patient, experts suggest that taking around 1,000 to 1,200 milligrams DHA and 1,800 to 2,000 milligrams EPA, which is equal to 5 to 10 capsules of fish oil each day, can help. However, excess intake of fish oil supplements can cause side effects like heartburn, loose stools, and nosebleeds. You can also get these omega-3 fatty acids from fatty fish like mackerel, sardines, salmon, and herring, or seeds and nuts like flaxseed, chia seeds, walnuts, and soybeans. Number 2. Fiber. Fiber plays a role in detoxification by binding waste products and promoting regular bowel movements, which helps the body remove them more efficiently. This reduces the burden on the kidneys, which may already be struggling to filter out toxins. Fiber also helps regulate blood sugar levels. Soluble fiber slows down the absorption of sugar into the bloodstream, which is especially important for people with kidney disease, as high blood sugar can damage the kidneys over time. Another key benefit of fiber is its ability to lower cholesterol. Soluble fiber binds to cholesterol in the digestive tract and helps remove it from the body. Since people with kidney disease often face an increased risk of heart problems, lowering cholesterol helps protect both kidney and heart health. Moreover, fiber also feeds the friendly bacteria in our gut. These bacteria, in turn, help in the removal of uremic toxins like urea, uric acid, ammonia, and even creatinine. So, what happens when you do not take enough fiber? It causes a buildup of these uremic toxins in the body. This, in turn, creates an environment that is less favorable to these friendly good bacteria, and more favorable for the harmful bacteria, resulting in the production of more uremic toxins. So, when you have kidney disease, it's important to ensure you're getting enough dietary fiber. The general daily recommended intake is around 25 grams for women and 38 grams for men under the age of 50. Some of the important fiber-rich foods that are also kidney-friendly include raspberries, blueberries, strawberries, apples, green peas, brown rice, peas, and lentils. Number 3. Vitamin D. Vitamin D in its active form helps balance calcium and phosphorus in your body, two of the most important minerals that regulate parathyroid hormone, a hormone that helps the body maintain calcium levels in the blood and tissues. Vitamin D also plays a vital role in supporting the immune system and regulating inflammation. For people with kidney disease, getting enough vitamin D can be particularly challenging because the kidneys are responsible for converting vitamin D into its active form. When kidney function is degraded, this conversion process becomes less efficient, which can result in vitamin D deficiency. In vitamin D deficiency, the body cannot balance calcium and phosphorus levels in the blood. This results in excess production of parathyroid hormone that signals calcium to pull out from bones into the bloodstream. When calcium levels become too high in the bloodstream, it can start depositing in the kidneys, causing calcification. Calcification can cause severe kidney damage and might even lead to kidney failure. Moreover, vitamin D helps regulate blood pressure, which is a critical concern for kidney patients, as mentioned earlier. Usually, vitamin D deficiency is treated by supplements of vitamin D, with doses ranging from 50 to 100 micrograms or 1 to 2 capsules per day. However, remember that it is important to take vitamin D with vitamin K2. This is because vitamin K2 helps to direct the absorbed calcium to the bones where it is needed, instead of blood vessels where it is dangerous. You can also get vitamin D from foods like fatty fish, including rainbow trout, sardines, salmon, egg yolks, and mushrooms. Number 4. Iron. One of the common complications in kidney disease is iron deficiency anemia, which is caused by low levels of iron in your blood. It happens because the kidneys play a role in producing erythropoietin, a hormone that stimulates the production of red blood cells. When kidney function declines, erythropoietin production decreases, which results in lower red blood cell production and often iron deficiency. So, this is where getting iron can help. It helps the body to make the protein hemoglobin, which improves oxygen delivery to tissues and organs. The general dosage of iron supplement is around 325 milligrams orally 3 times a day. However, it can vary depending on your iron and hemoglobin levels. You can also take iron from foods like red meat, poultry, fish, beans, lentils, spinach, and iron-fortified cereals. Moreover, taking iron with vitamin C increases its absorption. Foods containing vitamin C include citrus fruits, strawberries, and sweet peppers. Number 5. Vitamin B12. People who have kidney disease are at a greater risk of anemia or low red blood cells in the body, and one of the primary reasons behind this can be vitamin B12 deficiency. Vitamin B12 helps the body to make healthy red blood cells, DNA, and nerve cells. But with kidney disease, your body cannot effectively process and use vitamin B12 present in your body, leading to deficiency of this vitamin. Additionally, kidney patients who undergo dialysis treatments may experience lower levels of B12 due to the removal of this vitamin during the dialysis process. So, people with kidney disease have to make sure that they are getting enough vitamin B12. It is recommended to take 2 to 3 micrograms per day of B12 supplements daily for both dialysis and non-dialysis patients. Remember that vitamin B12 is mostly given along with folate supplements, as both of these nutrients are crucial for the production of red blood cells. So, if you take only one of these, it may hide the deficiency of the other nutrient, and it can lead to anemia. Number 6. Vitamin C. Even though excess vitamin C can lead to the formation of kidney stones, moderate vitamin C intake actually helps improve kidney health. Studies show that vitamin C has anti-inflammatory and antioxidative properties that can help protect the kidney cells from further damage and slow down the progression of kidney disease. In addition to that, vitamin C also helps the body absorb iron and form and repair red blood cells, bones, and other tissues. For people with kidney disease, either with dialysis or non-dialysis, a dose ranging from 60 to 100 milligrams per day supplement is mostly recommended. Some foods can also help you fulfill your daily requirement of vitamin C naturally. These include citrus fruits, green peppers, broccoli, cabbage, and tomatoes. However, some of these foods contain high levels of oxalates and potassium, so make sure you consult your kidney dietitian to make the right choices. Number 7. Magnesium. Magnesium plays a crucial role in maintaining the kidney's normal functions as it keeps calcium dissolved in the blood. It helps regulate parathyroid hormone production. So, if your body does not have enough magnesium, it can cause an increased production of parathyroid hormone that could lead to a false alarm of calcium deficiency. As a result, calcium may end up depositing in the kidneys, leading to severe damage. So, there needs to be a proper balance of magnesium to calcium, about a 2-to-1 ratio, because if there is more calcium taken without the balancing effect of magnesium, it could lead to magnesium deficiency or excess calcium in your body. The daily requirement of magnesium for most adults ranges from 320 to 420 milligrams per day. Just remember, if you're getting enough calcium from food sources such as dairy products, leafy greens, and fortified foods, you might not have to take additional calcium supplements. Many people meet their calcium needs through diet alone, especially if they consume calcium-rich foods. However, some magnesium-rich foods such as broccoli, avocado, spinach, pumpkin seeds, chia seeds, almonds, and cashews may not be suitable for people with kidney disease due to their high potassium content. Number 8. Zinc. Zinc is essential for kidney function, as it plays a crucial role in regulating how much sodium your body absorbs. If your body becomes deficient in zinc, it can cause your kidneys to retain more sodium. When there is excess sodium in the body, the kidneys have to work harder to filter it out. If the kidneys are unable to remove enough sodium, it can build up in the blood, leading to high blood pressure, which can further damage the kidneys. Therefore, if you are a kidney patient, it's important to ensure you're getting the right amount of zinc. For most adults, the recommended daily intake is typically 15 to 30 milligrams of zinc. You can obtain this from a variety of zinc-rich foods, including meat, fish, and seafood, like oysters, canned salmon, and mackerel. Among these, oysters are particularly rich in zinc, containing about 74.1 milligrams per 3-ounce serving of cooked, breaded, and fried oysters. However, it's important to note that zinc should ideally be taken in balance with copper, another essential mineral that supports red blood cell production and immune function. Excessive zinc intake can interfere with the absorption of copper, potentially leading to a copper deficiency. Many doctors recommend supplementing with about 2 milligrams of copper when taking zinc supplements to avoid this imbalance. Number 9. Vitamin E. Vitamin E is an essential antioxidant that helps prevent the production of reactive oxygen species in the body, protecting vital organs like the kidneys from damage. It also plays a role in the formation of red blood cells and helps widen blood vessels, reducing the risk of blood clotting. This helps maintain healthy blood flow, preventing high blood pressure and kidney damage. Most healthy adults require approximately 15 milligrams of vitamin E daily. However, individuals with kidney disease need to be cautious about their vitamin E intake. Excessive amounts of vitamin E can accumulate in the body and lead to serious kidney damage. Foods such as almonds, peanuts, beet greens, spinach, pumpkin, and red bell peppers are excellent sources of vitamin E. Number 10. Vitamin K. Vitamin K plays an important role in preventing the buildup of calcium in the body tissues, which is a common complication in chronic kidney disease. When calcium starts depositing in the arteries, heart, and kidney tissues, it causes permanent damage that can lead to kidney failure and death. Vitamin K, especially vitamin K2, prevents that by activating a protein that removes calcium from soft tissues. At the same time, it also activates another protein that holds calcium to the bones. That's why getting enough vitamin K is crucial for people with kidney disease. Almost 90 micrograms for women and 120 micrograms for men per day is recommended. Moreover, many leafy green vegetables like kale, spinach, turnip greens, collards, Swiss chard, mustard greens, parsley, meat, cheese, and eggs are rich in vitamin K. However, many of these foods are often restricted for kidney patients due to other dietary concerns. As a result, it may be best for individuals with kidney disease to take vitamin K as a supplement. Number 11. Selenium. Selenium is a trace mineral that plays a vital role in the body's antioxidant defenses, immune function, and thyroid health. It works in conjunction with other antioxidants, such as vitamin E, to protect cells from damage caused by free radicals. For kidney patients, selenium is important because it can help protect the kidneys from oxidative stress, which is a key factor in the progression of kidney disease. Selenium also plays a role in thyroid health, helping to regulate thyroid hormones. Since kidney disease can sometimes affect metabolism and thyroid function, maintaining proper selenium levels is important for overall hormone balance. Selenium can be found in foods, including crab, fish, poultry, and wheat. Your body needs this mineral only in trace amounts. The general daily recommended intake is around 55 micrograms daily for all people 19 years and older. Number 12. Vitamin B9 or folic acid. Vitamin B9, or folic acid, plays a critical role in DNA synthesis, cell division, and the formation of healthy red blood cells. For kidney patients, getting enough folic acid is especially important because it helps prevent anemia, a condition that is common in those with chronic kidney disease. Moreover, folic acid also helps reduce homocysteine levels in the body. Homocysteine is actually an amino acid. High levels of homocysteine increase your risks for heart disease and stroke. Studies have found that most people with chronic kidney disease have high levels of homocysteine, which increases the risk of heart problems that could lead to kidney damage. However, vitamin B9, along with vitamins B12 and B6, help break down homocysteine to create other chemicals your body needs and prevents this risk. The recommended daily amount of folic acid is 400 micrograms. Its natural sources include vegetables like spinach, asparagus, Brussels sprouts, and citrus fruits, especially oranges. However, it's important to consume these foods in moderation due to their dietary concerns. Thanks for watching. But that's not it. If you want to know more about how you can improve your overall kidney health, make sure to watch these videos too.